Dr. Carissa Etienne, a native of Dominica, began her 5-year term as Director of the Pan American Health Organization, Regional Office for the Americas of the World Health Organization in February 2013.
Let me begin by thanking the member states of PAHO and the WHO Executive Board for granting me this opportunity to move forward the mandate of this great organization. And this is why we must all work together to meet the aspirations of our citizens for health equity, human dignity, and economic and social opportunity. I thank you so much. Good day.
Two months later, she made her first official trip to the Caribbean. The director visited Barbados to attend the annual PAHO WHO Caribbean Country and Sub-Regional Managers meeting and was warmly received by all. During her visit, she also met with senior officials of the Ministry of Health and staff at the Barbados office. St. Lucia was the first OECS island she visited following her appointment as PAHO director. During her 2-day visit in September 2014, she met with officials of the Ministry of Health, paid a courtesy call to the Governor General, and toured the new National Hospital. Following the Ebola outbreak in 2014, PAHO Washington and WHO Geneva organized experts in communications and international health regulations to train Caribbean member states in risk communication. In a virtual address to participants, Dr. Etienne reiterated the organization's commitment to supporting the Caribbean sub-region and wider Americas in developing adequate response capabilities for public health events. Her first official visit to St. Kitts and Nevis was in February 2015, at which time she participated in the annual PAHO WHO Caribbean Country and Sub-Regional Managers meeting. The director met with Prime Minister Timothy Harris and senior health officials to discuss ways of strengthening technical cooperation. As the new director of PAHO, she made her first official visit to her native country, Dominica, in July 2015, accompanied by PAHO WHO representative for Barbados and the Eastern Caribbean countries, Dr. Godfrey Schreb. She met with health authorities and other high-level officials to discuss the work of PAHO WHO. Her first official visit to St. Vincent and the Grenadines was in February 2016. During the week-long visit, she participated in the annual PAHO WHO Caribbean Country and Sub-Regional Managers meeting, met with Governor General Frederick Ballantyne, Prime Minister Ralph Gonsalves, and other ministry officials. There were symposiums on Zika and hand washing, and visits were made to a smart hospital in Georgetown and the Carib community in Fancy. Dr. Etienne paid an official visit to Grenada in June 2016. She met with Prime Minister Keith Mitchell. They discussed the importance of prevention and management of non-communicable diseases. A visit was made to St. George's University, which houses a PAHO WHO collaborating center. Princess Alice Hospital, a planned smart facility, was also visited. A meeting was held with senior officials of the Ministry of Health, and there was a town hall meeting to brief the public on the current Zika situation.
Health is wealth. How many times you did not go to work? You're sick. Production going down, and you're dragging your country to the ground. Too much salt and sugar, too much snacks and soda. You need to get moving. Start exercising. Fruits and vegetables should be part of your diet. A colorful plate is what you need. Your environment you can't forget. Keep it clean so you won't regret. Diabetes, cancer, and hypertension on the rise. Don't let them catch you by surprise. Get yourself checked today. Don't postpone it for another day. A healthy nation is a wealthy nation. Get on the healthy train today.
In July 2016, the director hosted a meeting of health ministers from the UK overseas territories in the Caribbean at the PAHO WHO office in Washington, D.C. This was to agree on new priorities for technical cooperation to improve the health of their populations. The ministers and director signed a strategic note outlining a new cooperation strategy. She returned to Barbados in October 2016. During her visit, the director met with local and regional stakeholders. She toured the David Thompson Health and Social Services Complex and the island's mental health facility. Dr. Etienne always supported staff events. On this visit, she participated in the 2016 PAHO WHO Barbados Staff Awards. In February 2017, the annual Caribbean Country and Sub-Regional Managers Meeting was held in the Twin Island state of Antigua and Barbuda. The PAHO team held intensive discussions on opportunities and actions required to improve efficiency and effectiveness throughout the Caribbean. After Hurricane Maria devastated Dominica in September 2017, Dr. Etienne toured her native home.
Following what is one of the worst disasters in recent history, and a disaster that is compounded by our terrain, a disaster that was compounded by the lack of communication, and still the difficulty in accessing some communities.
In recognition of Barbados' 50th anniversary as a member state of PAHO, she visited Barbados in November 2017 to participate in activities, including the Staff and Health Heroes Awards. The third Global Conference on Health and Climate Change convened health authorities and experts to develop an action plan for small island developing states in the region. The conference took place in Grenada in October 2018. I don't need to convince anyone in this room that the present situation is critical, added Dr. Etienne. Health is being impacted by climate change in many ways, and although SIDS have made a small contribution to global emissions of greenhouse gases, our islands are at the forefront of climate change impacts. While still in Grenada, she participated in the inauguration of a smart healthcare facility. The Princess Alice Smart Hospital in Grenada was the first healthcare facility to have been refitted to smart standards in the Eastern Caribbean. On November 26, 2018, Dr. Etienne delivered the feature address at the 43rd Sir Winston Scott Memorial Lecture in Barbados. The topic was Healthcare Reform and the Role of Technology. On a visit to St. Lucia in April 2019, Dr. Etienne met with Prime Minister Alan Chastanet, made a presentation to the Cabinet of Ministers, and congratulated the government for taking steps towards achieving universal health. She assured that PAHO would continue to work closely with them towards the integration of subsystems, pooling of resources, and mitigating risks. The director attended several meetings during her visit, including the annual PAHO WHO Caribbean Country and Sub-Regional Managers Meeting and the launch of the Caribbean Action Plan on Health and Climate Change, a roadmap established to ensure that health is front and center of national climate change planning. COVID-19 reached the Caribbean in March 2020, but we were not alone. Under the directorship of Dr. Etienne, COVID-19 vaccines were made accessible to countries, essential equipment and supplies were provided, as well as training opportunities. The focus was on saving lives, protecting health workers, and suppressing the spread of the virus. She has hosted numerous press conferences, competently leading PAHO WHO through the COVID-19 pandemic and providing clear direction in this unprecedented chapter of our history. The director has been lauded by Caribbean leaders for her guidance during the pandemic.
Dr. Etienne, your leadership, your advocacy, your ability to network, and your unwavering contribution to the people of the Americas, with specificity to Barbados and the Eastern Caribbean, signal to us your desire for diversity, and inclusion as we build a partnership of hope across the region. On behalf of our Prime Minister, the Honorable Dickon Mitchell, the people of Grenada, Carriacou and Petite Martinique, and from the desk of the Minister for Health, long after you've served, may the work of your hands be blessed and may your impact be felt for generations to come. God bless you.